Before I start the head to toe assessment, I would gather necessary supplies such as a stethoscope, pen light, watch with a second hand, thermometer, blood pressure cuff, and pulse oximeter. Knock, knock, knock. Hi, I'm Jared Scott. I'll be your student nurse today. Provide hand hygiene, provide privacy, or do hand hygiene and then provide privacy. Would it be alright if I did a head to toe assessment on you?
Yes.
Do you have any questions about the head to toe assessment?
No.
Can I have you tell me your name and date of birth?
Rachel Scott, 11/10/98.
I would check that against your wristband and the chart. Then I would take vitals, and they're all within normal limits. Do you have any pain?
No.
Okay. Is it alright if I ask you a couple questions?
Yes.
Who am I?
Jared.
Where are you?
The hospital.
What day of the week is it?
Wednesday.
And why are you here?
Head to toe assessment.
Patient is alert and oriented ×4. Patient's hair is washed and clean. They have good posture and a normal build. They are showing no signs of stress. They have normal emotions for the situation and have good speech. Do you have any cultural preferences?
No.
Okay. First, I'm going to check your pupils. They are equal and round at 6 millimeters. I'm going to shine the light in your eye. Reactive to light. Okay, I'm going to have you look at the tip of my pen and then look at the wall over there. Look at the tip of my pen. Look at the wall. Look back at the tip of my pen. They accommodate. I'm going to have you follow the tip of my pen with your eyes only. It's good extraocular movement. Tell me what, keeping your eyes forward, can you tell me when you see the pen?
No. No.
Is good peripheral vision. Alright, is it alright if I touch you?
Yeah.
Starting at the temporal pulses, we check for for quality, strength, and for symmetry, strength, and quality, check the carotid pulse, check the brachial pulse, check the radial pulse, cap refills under 3 seconds. Maybe you squeeze my fingers, maybe push up on my hands, maybe push down on my hands. Her grip strength and arm strength is equal and strong. Can I have you close your eyes? Where am I touching you?
Left forearm.
Where am I touching you?
Right forearm.
Throughout the assessment, I am checking skin for temperature, color, quality, any signs of skin breakdown such as edema and moisture. Can you open your mouth and tilt your head back? For oral and nasal mucosa is pink and moist. Alright, I'm going to start my lung assessment. Have the patient in high Fowler's position. Starting at the top, we have bronchial, bronchiovesicular, 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 vesicular, 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 making sure that we are in the intercostal spaces, not on top of the ribs or any bone. High tones are higher at the top, high tones are louder at the top, low tones are louder at the bottom. Can I have you cross over your arms and lean forward? Again, we're assessing lung sounds, making sure that she's breathing in and out in each spot. Okay, you can sit back up. Next will be listening for heart sounds. So in the second intercostal space, right sternal border is the aortic sounds. Second intercostal space, left sternal border is pulmonic sounds. Fifth intercostal space, left sternal border is tricuspid sounds. And fifth intercostal space, fifth intercostal space, midclavicular line is mitral sounds. S2 is louder on the top, S1 is louder at the bottom. Alright, now I'm gonna ask you to sit back. Now, do you have any concerns about bowel movements?
No.
When was your last bowel movement?
This afternoon.
How frequent are your bowel movements?
Once a day.
Is that normal for you?
Yes.
Do you take anything to change your bowel movements, like laxative?
No.
Okay. Now we visualize the abdomen is symmetrical with no lumps or contusions. Then we will auscultate the bowel, starting in the right lower quadrant, listening for a minute in each spot, listening for irregular gurgles every 5 to 10 seconds, moving in a clockwise motion. Then we would palpate the bowel, making sure that it is soft with no masses and no pain. Do you have any concerns about urination?
No.
Do you have any concerns about the frequency, color, or odor of your urination?
No.
Do you have any sexual health concerns?
No.
Okay. Is it okay if I touch you near the groin?
Yes.
I would check femoral pulses, popliteal pulses, posterior tibial pulses, and pedal pulses. Checking for symmetry, strength, and quality. Cap refill is less than 3 seconds on both toes. Have you push up against my hands. Have you push down against my hands. Her legs are equally strong on both sides. Have you close your eyes. Tell me where I'm touching you.
Right calf.
And you tell me where I'm touching you.
Left calf.
Do you have any pain, numbness, or tingling in your hands or feet?
No.
Okay, you can sit up. Do you feel lightheaded or dizzy?
No.
Alright, can you stand? Can I have you stand up for me? Feel lightheaded or dizzy?
No.
Can you stand with your hands out in front of you, palms up, and close your eyes? We're checking for drifting and balance issues. She has no balance issues. You can open up your eyes. Have you pat your palms and the backs of your hands against your thighs. Good coordination. Alright, I'm going to have you take 5 steps that way and 5 steps back. Her gait is good. Again, her skin is normal. It has appropriate color, temperature, no excessive moisture, and there are no signs of skin breakdown. Vitals were normal, and pretty much everything was normal. I would document all these findings in the chart, and the head-to-toe assessment is over.